Recording started. So, thank you again. We will be talking about bridging language barriers, interpretation and translation supports for healthcare providers and in the community. Our objectives today are to facilitate reflection on the value of interpretation translation in clinical health practice, to provide information on available services and resources for effective interpretation and translation support in the health system, and to provide information on available services and resources for effective interpretation and translation support in the community. So I'm going to hand off to Laura Branner, who will be the MC for this session.
What if I get there and
There's some Jordan Appleby. Could you please mute your line?
Okay, we ready?
We are.
Okay, hello. I'm Laura Brenner, and I'm the coordinator of Lethbridge Local Immigration Partnership, also known as LIP. LIP is the community development initiative that is funded by Immigration, Refugees, and Citizenship Canada, IRCC. Our initiative is housed at Lethbridge Family Services, and it began in 2016. And just for your information, there are 77 LIPs in communities across the country, all with the purpose of engaging the community in the settlement of newcomers and making their community more welcoming and inclusive. Lethbridge LIP partners with representatives from more than 40 organizations and coordinates 4 working groups and 2 committees. Lethbridge Newcomer Health Advisory Group had formed and was working together for several years prior to the start of LIP. It made sense for us to work together, and we are happy that it is now a working group of LIP. On a personal note, I have a background in community development, and Lethbridge LIP is my 4th community development initiative I've coordinated. In addition, I am a certified ESL instructor and taught a variety of levels, ranging from learners with limited English to high-level grammar classes at the university level. So learned lots about the needs of newcomers. First thing that we're going to talk about is why using interpretation and translation services matter. So Dr. Bly, I'm going to ask to introduce himself, and he's going to talk about patient health and safety outcomes.
Hi, I'm Dr. Bly. I'm a family doctor by training and one of the founding members of the Lethbridge Newcomer Health Advisory Group. And I had a large Nepali-speaking population in my practice for quite some time, and I am involved to some degree with the Nepali-speaking population. So that's how I got into language barriers and interpretation services. So why are we even having the discussion? First off, best healthcare practices require a thorough history and physical, which is difficult to do with a language barrier. It takes extra time, it takes sometimes extra equipment, different resources, it takes some advanced planning. You may be dealing with different dialects of the same language and still having problems with communicating. So all of that takes extra time, but you will get better patient outcomes when you communicate more effectively, and overcoming a language barrier would certainly be a better communication. And I hate to use this, but doctors are always scared of litigation, and if something were to go wrong and you had access to interpretation services like the language line or something else and you didn't use it, none of your excuses would matter. So if you do have interpretation services and you use them and they're not the best, you have difficulty, communication still isn't ideal, at least you did what you could to optimize patient care. And sometimes we just don't have that language available, or it's difficult, or there's a different dialect or things like that. So it does take extra effort, extra planning, but using interpretation services such as the language line or in-person interpretation is well worth it when you consider patient health and safety rather than provider convenience. So that's my spiel.
Great. Thanks, Dr. Bly. I'm going to now have our participants take part, we have some polls for you, and we would like everybody who's on this call to take part in the polls. So we're going to do the first one, and all right. In your practice, how often do you encounter clients who have difficulty communicating in English? So if everybody could take a moment so we can complete the poll. All right. 21. So just click on the button that reflects your response. A few more minutes, or a few more seconds, I should say. So 12, 22, 29. Okay, 29 participating. I'm going to save that poll results. Okay, now on to our second poll. Oh, sorry. We're going to ask you which services that you use for interpretation. So again, asking everybody to take part. Which interpretation and translation services do you use? 47 people on the call. Go. Lot for language line there. And the bottom answer, anyone who speaks Polish, it's not particularly Polish, it's whatever language you're looking for.
Can we pick more than one?
Yes?
It doesn't seem to work that way.
Doesn't it? You can't pick more than one. Okay.
Nope.
All right. Yep, I get what you're saying, Nolan. So, okay. Everybody had a chance to vote? All right, I'm going to save the poll results. Okay. All right, and last poll. Why would you not use interpretation translation services? And we use the example of language line interpretation here. Okay, response is coming in. All right. Why would you not use interpretation translation services? Any last responses? Yes, that's right, Tina. You're an interpreter, so that one doesn't apply to you. All right. Okay, I'm going to save that poll and stop presenting. And I'm going to hand it over to Laura to start introducing the next speakers. Thank you.
Okay. We're going to look at voices of experience, bridging language barriers in the clinical setting. So I'm going to call again on Dr. Bly and Lindsay Schwab. Lindsay Schwab is a registered dietitian at the Alberta Healthy Living Diabetes Program in Lethbridge. She provides diabetes education to a variety of clients and attends newcomer clinics throughout the year to provide health screening and chronic disease referrals for newcomers to Canada. She has been working with the Lethbridge Newcomer Health Advisory Group for the past year and has been involved in webinar planning in this time. All right, so Dr. Bly and Lindsay Schwab, I'll let you take it from here.
Why don't you start, Lindsay?
Sure. So when we were talking about this in webinar planning, we were talking about, what can we do to make it a little bit easier to speak with people who are low language clients. So they maybe are English isn't their first language. So what we had kind of come up with, actually the LIP has some good resources for this as well, but what's really worked in our practice, in our clinic, we often use language line. That's our probably the most the biggest resource that we use for low language clients, but I also work with interpreters face to face in our clinics, in our newcomer clinics. But using Language Line, we find it helpful if we can get Language Line up and running before the client comes in, just to give them kind of a brief on who's coming, what we're going to be talking about. I think it's helpful. If it's a language or a culture that we're not super familiar with, they can often give us some tips. Yeah, and then we try to keep Language Line on the phone after the visit as well, if we just have a few minutes to debrief, just to sort of let them give us any tips that could be helpful in the future, actually, or anything that was difficult for them to interpret. What the feedback we've sort of got from that is that it's best to use plain language wherever we can. So being very aware of our medical jargon and the medical words we use, trying to find different ways to say things in an easier to understand way. We find it helpful to, instead of asking, do you understand, we often get yes, whether we feel that's true or not. So a teach back is a better way of learning understanding. Just trying to get them a little bit more involved, hands-on, showing us that they understand rather than just yes or no. So those are things that have worked really well for us. Plain language is a big one though, and that's, I think, a challenge for a lot of us as we are used to using our big medical words and not used to speaking in a language that's helpful for the average person out there.
So a few other things. As much as possible, plan ahead. Know what language you need. See if you can figure out if they know English, how much they know. Don't assume anything. Like Lindsay said, if you say, do you understand? And they nod their head yes, that doesn't mean they understand necessarily. Plan extra time and know your resources. Do you have access to Language Line? Do you have access to interpreters? That sort of thing. The best interpretation would be a professional interpreter in person. In my opinion, the next best would either be the Language Line or sometimes an untrained adult non-family interpreter. Next, I would say, would be an adult family member and then a younger non-adult family member. And the reason we try and avoid family and child interpreters is partly cultural. Some parents will not discuss certain subjects with a family member or a child present. Some topics are not well understood by a child interpreter, so they have a hard time communicating to their parent or relative what the issue is because they don't understand the words. So that's like using plain language. Sometimes it's still not language that they know because it's a subject that they have not learned about. And there's a lot of that in medicine. Be culturally sensitive. Again, sometimes individuals will not share if there's a family member present, if there's a male present, or if there's a child present. And there are many other cultural issues that could come up, and I just those are the first ones that came to mind. So that's
right.
It from me.
You're good. Well, it's my pleasure to introduce two of our translators. I have in the room with me Mohammed Abushaban. He is an Arabic interpreter and translator. He's been interpreting for 7 years and 4 with Lethbridge Family Services. We also have Hector Torres. He's a Spanish interpreter and translator, interpreting for 11 years and 2 years with Lethbridge Family Services. And they're just going to share some of their hands-on experience as interpreters.
Hello, everybody. My name is Mohammed. I'm an Arabic English interpreter.
Oh, we can't hear you.
Okay. Can you hear me now? You need to be down.
Much better.
All right. Okay, let's do it this way. Can you hear me now?
Yes.
All right.
Just bear with us a moment.
All right. Change of plans. Can you hear me now again?
Yes.
All right. Um, my name is Mohammed Abu Shaban. I'm an Arabic to English, English to Arabic interpreter here in Lethbridge. Been with LFS for quite a while, and before I actually dig in deeper into the interpretation, I just would like to extend my sincere thanks to all the settlement practitioners here at Lethbridge Family Services, who actually from the first day, they take care of the newcomers, thriving to ensure their services are provided, placing them into hotels, residential, and all of that, taking them to doctors, booking some doctors' appointments, and all of that. And I also would like to, I mean, I can go on and on about them. I'm very passionate about their services, and I think they're doing an amazing job, although this is not what I'm supposed to be talking about, but I felt like I have to. I just want to add to this the contribution that of all of this, which is finally, I'm saying the amazing contributors in all of this, in which without none of the work probably cannot be achieved, and that is the interpretation. And the interpreters with their amazing, talented manager who is really distributing, making sure that the interpreters are doing the job. And just to give you a little taste of what interpreters do, I would like you to imagine that. I would like to imagine what it would be like to speak without anyone understanding you. Just put yourself in that situation, or being or having an urgent need and you need help, but no one is really knowing what you want. Or imagine not being able to meet the needs of your family, not knowing the available resources at the community and the community services. Imagine if all what you say can be understood, your needs are met, and you can apply for the community programs that fits your need. We are the hub that connects you with the ones they don't understand you. We are the interpreters. Interpreters, we are you, and we are also them. We will interpret your feelings, your needs, your opinion. We will deliver your voice, your concern, and your gratitude. We will deliver everything you say to those who know how to get the job done and get the need fulfilled. And if they cannot, they will provide you alternatives. They talk to you through us, and you talk to them through us. So we are you, and we are also them. Sorry about this long introduction, but I actually felt I had to say, I have more, but time constraint. I'm not going to say much, but I wanna just maybe mention few things here about the interpreters and what we do, and how we fulfill all the language barriers, which is a given. We do lots of work on behalf of the clients, but not being the clients. So we're basically in the middle. I would like to agree, and I would like to agree with Dr. Ply, who said that the best interpretation is done through the human interpreter, and I really do agree about that. You know, not sending interpreters. This is one of the not very good things I have is not sending interpreters to hospitals and doctors. That is something I think you lose certain touch. Not only the words, sometimes it's the body language that makes a difference. So I think that's one good point. Is we do need to send interpreters or enhance maybe the language. We also sometimes go without prior knowledge of the situation, and it is very important to know ahead of time what we are going to. We do have lots of notes, but sometimes I think maybe we are missing some information, which makes it very difficult to interpret the whole scenario, not just word by word. We do have some limitation on the information that is provided to us as interpreters. Although we all, we have the consent and we sign, we're not going to release any information, but we still don't get much. One thing new, I think, recently has been happening that we're not supposed, interpreters, we're not allowed to fill any forms on behalf of the clients. I think I see the reason behind it, but that sometimes creates an issue between us interpreters and the service provider. You as doctors or clinics or whoever, they don't like the fact when we say, you know what, we're not allowed to really fill forms. Some of them take it really aggressively. They pull the form, say, oh yeah, well, we'll do it. And others, they're very kind. They say, oh, okay, we understand. That is something we are facing as an issue. And to improve, my improvements, the points I put down, I actually wrote that it will be a lot easier if the interpreter knows what he or she is going to interpret for. We know the topic, but we don't know the details. The interpreter should be briefed in advance of what the situation is, and the interpreters should be able to fill forms, thus avoiding any conflicts with the service providers, or all forms maybe to be pre-filled, send it to whoever we're working for, they fill it, then they give it to the customer, the client, and the client gives it out. What I'm trying to say is, don't put us interpreters between the client and the service provider in other way than just simply interpreting. We don't want any conflict. And let the interpreters be part of the language line. I don't know, lots of people talking about the language line. So let's do something about that. Maybe we should be part of the language line. Make us be the primary selection, maybe if you're looking at a certain area. If you're looking at Lethbridge, then language line should probably select certain people within Lethbridge to do this, because it does make a difference interpreting to those while you are in the same city they're living in. This is it for me. Sorry I took so long, but I have a lot more, but this is it. Thank you.
All right, is that a good mic there? Can somebody confirm? All right, Hector Torres here. I'm Spanish, English, Spanish with been on the interpreting for quite a few years now, and well, I have learned a lot during this experience. I have pretty much tried all different aspects of interpreting, starting by being a volunteer and serving to friends and family, and then becoming a trained interpreter and working as a trained interpreter in a whole different setting. Couple of things that we already discussed are really important, and I wanted to highlight those parts. Dr. Lindsay? Yeah, thanks. Sorry about that. Talk about briefing meeting, and that is something that I consider really important when it comes to interpreting processes. As my co-interpreter here, Mohammed, said, we need to have some information ahead of time to be able to understand the whole context of the situation. But at the same time, we need to keep in mind confidentiality. That is something that is a note of confidentiality that we as interpreters keep all the time, and we have to sign and we have to respect. So we need to know just the basics of the situation to be able to understand what's happening and why is it happening. That helps a lot with the interpretation, so the interpretation is more accurate. So that's something to keep in mind. And as well, the debriefing, as was already talked about, it helps the interpreter to provide some feedback and improve the future experience. But at the same time, sometimes interpreters are exposed to so much information in different settings, like when it comes to legal and medical situations. Sometimes that's actually can affect interpreters, and just for the well-being of the interpreter, sometimes it's good to give them a chance to debrief of that situation. That's a practice that they recommend in interpreting training. So I'll talk a little bit about the role of the interpreter. Most of it's been talked about, but I want to just highlight some parts. As community interpreters, our role is to deliver a faithful as possible message transmitted between parties who do not share the same or a common language on a diverse range of health, social, and community service settings. We have responsibilities in relation to all parties. So we're supposed to explain our role, and this is something important. Are we still on here? Okay, so yeah, we're supposed to explain our role to both parties, the service provider and the non or limited language speaker. This is important because on that introduction, and this is where the challenge comes for some settings. I have been in situations where I go to a doctor's office and I say, okay, well, this is my name. I'm Hector Torres. I would like to introduce myself to the doctor, and I would like to introduce myself to the patient and explain my role and how things will work here for as an interpreter. But sometimes people say, oh, service providers say like, oh, we don't have enough time. Like this is a 30-minute appointment and we have to talk about so many things. Well, this introduction that interpreters are supposed to do, trained interpreters in every meeting, helps to control the flow of the communication and to avoid some situations that will actually create trouble or misunderstandings. So in that introduction, we explain who we are, where we come from. We explain people that we're supposed to deliver the message as faithful as possible, and that we'll be interpreting everything that's been said in the room. Sometimes you have a patient with a family member, and they start having a conversation there that's not related to the appointment, and the doctor is kind of wondering what's going on here. Are they talking about this situation? Are they talking about medical issues? Are they concealing some information that's important for the diagnostics or something like that? So we as interpreters are supposed to interpret that conversation, but that conversation may be related to soccer or a drama on the TV. So my role is to let people know in that introduction, here, I will be interpreting everything that's been said in this meeting, and I actually take the time to tell them, like, if you have something that's not related to this appointment, please keep it to yourself. Avoid that conversation because I'll be interpreting, and then the doctor will be knowing if you're talking about the meal or about whatever. So I take a few seconds just to highlight that because that will control the flow of the conversation. As well, I remind people to speak in the first person. This is another situation that can turn a little bit confusing. Sometimes service provider will say, like, please tell him or tell her this or that. And then me as a trained interpreter, I'm supposed to say exact same thing. And then that will sound confusing to the client. So when we keep the first person, just pretty much pretend that there's no interpreter in the room. Doctor will be speaking to a patient in English, as an example in my case. Patient will be speaking to the doctor in Spanish. And I'm the interpreter. I'll be kind of sitting on the middle and just switching the language from the message, from one language to the other. And that will keep the flow of the conversation clear. There won't be like, please explain this, explain that, because then there is another extra addition on the communication that is not needed. So just pretend that there is no interpreter, that you're talking to that person in English and that person will understand you. That helps a lot. The timing is really important. We need to use short sentences when it comes to consecutive interpreting, which is the most commonly used one in this kind of settings, because there is another person talking to you. Then timing is really important. So using short sentences, somebody talk about really plain language, that's very important, but as well, interpreters supposed to be learning more lexicon, vocabulary related to different aspects of interpreting. So we're supposed to be taking training on medical interpreting, court interpreting, police services, and things like that. And that helps a lot. But at the same time, if the service provider helps with using a more plain language, that solves a lot of issues in the communication. The other thing that we're supposed to do as interpreters here is let people know that we'll be keeping everything confidential. Sometimes service providers are concerned about that part. That's something we cover in the introduction. So once we do the introduction, we're letting people know we keep the confidentiality and we're impartial in that situation. That gives the client and the service provider just the confidence that all the information will be transferred from one language to another with no issues. And usually, when it comes to the clients, they feel more confident that the interpreter won't tell anybody else in the community about the situation they're talking to about. And that helps when it comes to have all the information. Like that's one of the concerns that was talked about before. Sometimes if you use a family member or a minor on the interpretation, somebody related to a person, if there is some information that make the client ashamed or they don't want to discuss in front of a family member and the doctor needs for the purpose of the service, then that information can be missed. So having an interpreter that's not related, that's very, very important. As well, keep in mind interpreters may have to take notes to help the memory to be able to keep the full message accurate. So those notes, interpreters will, in the introduction, let people know that they may be taking them if they need to, but they may be destroying them like they will be destroying them at the end of the conversation as well, or we can hand them to the doctor, or if they're concerned about the information we're taking when it comes to confidentiality. So we clarified that in the introduction as well. It comes like as interpreters, we face so many situations when it comes to a complex language or words that cannot be found in the language we're interpreting to. So in those cases, and when there is a miscommunication or something, we need to clarify the situation. So we need to intervene in the communication, and in both languages, just let them know that we need to clarify something. That's something we explain in the introduction as well, and that helps to make sure that the message is accurate by the end of the interpretation service. And the other part that we do in the presentation as interpreters is just letting people, like asking people if they're okay with us as interpreters interpreting for them. Of course, the service provider will request the use of an interpreter, but the client sometimes may not feel comfortable with the situation, so we have to ask for their permission. And once we have their consent, then we can proceed to the interpretation. We cannot force people to use the service of an interpreter. So you as a service provider requested the interpreter, the person is has the right to refuse if needed. Yeah, and like we're having some technical issues here. Somebody would like to confirm if we're getting all the information here?
Yeah.
Okay.
Laura, are you there?
Yeah.
All right.
We're out of the computer for some issue here, so we wanted to make sure that you guys are listening to what's going on.
Absolutely.
Okay.
We had a question. Laura, do you want to address that? Can you? From Palliser Medical Clinic. Laura, are you there? Is Laura on the line?
Yeah, I'm here.
Okay, can't hear you.
Can you hear me now?
Yes. How much interpretation services are you, LFS, currently providing for primary healthcare providers? If you could just answer that, we can go into further discussion, but there was one question related to that from Palliser Med.
Can Marilise answer that?
Okay. We'll answer that question later on. All right.
All right. Hector,
Yep.
finished? Okay.
Well, I got a couple more things. As well as somebody talked about it already. We as interpreters need to maintain clear boundaries, and that's refrain from giving advice, expressing opinions, solving problems, mediating, or advocating for client or service provider. And as Mohammed said, sometimes we're put in those situations. So it's important that the service providers and clients know that we have a role and we need to remain in those boundaries as interpreters. So all of these issues that sometimes come during the conversation that may create miscommunication, misunderstanding, are solved if we do a proper introduction. Like this doesn't take long. Like I have talked about it for, I think, a good few minutes, but when it comes to a real interpretation services, it takes probably 30 seconds. It's a really quick introduction that needs to be done in both languages, and that will avoid so many other pauses during the rest of the appointment. So it's important that the service providers allow that time for the interpreter to introduce themselves and to them and to the client. Okay, just to conclude, I just want to just reinforce the part of the use of trained interpreters for the appointments. That's something that really will solve so many issues on the communication. Um, I think the interpreter in person helps a lot um, with the communication, but the interpreter on the phone as well is a really good option. Sometimes people feel more confident if they're not seeing a face, especially when it comes to community interpreting. I'm the interpreter in a situation, and then next day I'll be seeing the same person in the supermarket, and people may be concerned about confidentiality. So that's something that as well comes handy when it comes to the confidence of the clients. That's probably all I have to say. Thanks.
Thank you, Hector. Now I'm going to welcome Ellen.
We can't hear you, Laura.
Can you hear me now?
Yeah, get close.
Okay, I'd like to welcome Ellen. Ellen is the advisor with Alberta Health Services Interpretation and Translation Department. She is passionate about the importance of effective communication with patients as a cornerstone of quality health care. Her department provides phone and video interpretation solutions for limited and non-English speaking patients with a view to ensuring patient safety and providing patient and family-centered care. Welcome, Ellen, and she is going to talk a little bit more about the services that they can provide.
Yes, hello everybody. Sasha, you're going to share my PowerPoint, right? Can you guys hear me? Hello?
I can hear you.
Oh, okay. Sasha, are you going to share my PowerPoint, or did you want me to share it?
Nope, I've got it.
Okay, great.
I just have to put it up here. So.
Oh, no, that's fine. I'll get talking so we have time for Elise to talk at the end.
Yeah.
Okay. But I think, obviously, by the large number of people in this group, I think we all agree that good communication is really essential for healthcare. And I always like to start these presentations with the kind of fun fact that today in Alberta, 1 in 6 Albertans has limited or no English. So when you think that the best health outcomes are when a clinician and a patient speak the same language, we know that without interpretation, we're going to be in big trouble for about 1/6 of the population. And you can move to the next slide. These were the top 10 languages provided through our interpretation services in the South Zone last year. It's interesting to see the different languages. Arabic is #1 across Alberta. The other languages really vary depending on the waves of immigration or refugees that you get in your zone. So definitely the South Zone is the only zone that has Nepali in the top 3. My second fun fact for the day, and you can click, is that in the past 5 years through our department, we have provided interpretation in 157 different languages, which is pretty crazy and shows how diverse it is as a province. So the next slide, please. I think we've talked a lot about professional interpretation, so I'm going to try to keep this short again so that we have time for Elise to speak. But you had the opportunity to just hear from some professional interpreters, and it really does matter to use a professional. And a little bit to talk about what makes them professional interpreters. First of all, they have to have proven tested proficiency in both languages. So it's all very well and good if you speak Spanish fluently, but if you don't speak, you could stay on that one, English fluently, then you're not much good as an interpreter. Secondly, they're trained in the art of interpretation, and as Mohammed and Hector alluded to, it can be a pretty stressful job. You've got to get it right on the spot, so they're trained in that. Thirdly, they're trained in medical terminology. And I think Lindsay was saying that it's a best practice to use plain language, but I mean, obviously in healthcare conversations, medical terms are going to come up, so they need to study up on what those terms are. And then finally and importantly, they are trained, or they are sworn to confidentiality. Now you can switch. So then I was going to talk a little bit about the risks of miscommunication of the shortcuts that we take. And we already addressed this a little bit, I think, in some of the slides, but healthcare is quite busy, and sometimes we take these shortcuts for interpretation, and there can be some pretty big risks of miscommunication and patient safety. So I'll just go through them. The first one, if you click, is using fellow staff members. So you want to just be really sure that that staff member does have a good enough level of language to be an interpreter. It's not just because you took French immersion till grade 6 that you could be an interpreter. The next one is overhead paging. And I think that that was alluded to in the survey about anyone in the hospital who speaks Polish. Well, first of all, you obviously have no idea what their language skills are. And secondly, there's the fact that there's a confidentiality issue. And you don't know if they're going to go back and tell the community or people in the same language community. I think it was Hector who was talking about that. Sometimes you could just bump into members of your community in the grocery store, and you don't want them sharing that kind of private medical information. The next one is family, and family is always a tricky one. Family seems like a tempting option because they are right there, and they're usually willing to help. But Dr. Bly talked quite a lot about that, so I'm not going to go into too many details other than to quickly share a story that it was through a question raised by a British nurse when I was giving a presentation at the Stollery. And she said, what is our policy at AHS about using family? And I'm going to take this opportunity to tell you that while we are working on policy, we don't actually have an official policy that forces people to use professional medical interpretation. So my manager, Louise, and I do a lot of education to make sure people know why it's important and why those options are out there. And she said, oh, well, where I'm from, that used to be the case until this incident happened. And I find it a pretty powerful story, which is why I like to share it. So it was a Muslim woman, and she had to go through the consent process to have a hysterectomy. And she didn't speak English, so they asked her husband to interpret. But culturally for him, I guess it was awkward to talk about a hysterectomy. And so he explained to her she was getting a tonsillectomy. Well, she signed the consent and she had the surgery, but when she woke up, it was not a tonsillectomy she'd had. So that ended up leading to litigation and obviously was a terrible patient experience. So that's the kind of risks we take using family. I will answer your question in a second, Tina. I'm just going to click through the next one. So the next one is children. And Dr. Bly already talked about that, and I think we all understand that. Children talk about boo-boos and owies. They are not interpreters, and that's very stressful to ask them to be an interpreter. And last but not least, we have Google Translator. People ask me about that. Technology gets better all the time, but it is not there yet. Tina, I see that you asked, I'm surprised not to see Low German there. And yes, unfortunately, through Language Line phone services, we do not have access to Low German interpretation. We have Platte Deutsch, which sometimes works, but unfortunately, there's just not a pool of interpreters for Language Line that provide that language. I know that in terms of solutions, actually, I learned a lot from this very same group's webinar a few months ago. So,
okay, so I thought that meant that this was the languages that was prominent in South Zone, but I didn't understand that those were the languages that you use over Language Line. That makes sense then.
Sorry about that. Yeah, that's correct. I don't actually have any data over how much Low German interpretation is provided since it's not done through Language Line.
Right.
Okay, we can move on to the next slide, please. Okay, so our recommended method of interpretation at AHS is phone interpretation through Language Line, which seems to be, from the surveys, an option a lot of you use, which is great to see. Language Line offers 240 languages, 24/7, and really why it's recommended is kind of on the vectors of cost, quality, and speed. So it is centrally funded for anyone at AHS. We pay for that through our central budget. In general, for taxpayers, it's a low-cost option because we only pay under $1 per minute, and we only pay per minute used. Next, in terms of quality, they are professionals with medical training, and it's so extensive, like the 240 languages is really great. When you think back about how we offered 157 different languages, realistically, it would be hard to find in-person interpreters for all those languages in every place in Alberta. And then finally, it is quite quick. Actually, our average connect time is 27 seconds. It can take up to 3 minutes, but that's not very long. Next slide. This is just a kind of history of our usage, and you can see that it has really grown incredibly since 2007, from 6,000 minutes a year to last year 1.25 million minutes a year, and growing. Next. And how to use it. Sounds like a lot of you are familiar with it. So just really quick, you dial a 1-800 number, you put in your 6-digit client ID, which is site-specific. And I will talk about that afterwards. And then you press 1 for Spanish, press 2 for any other language, and then you say, for example, Arabic. And they're on the phone generally within 30 seconds. My next slide is about how to access the service. So there's kind of two different ways to access it. First of all, if you work for AHS, most hospitals and public health centers are already set up with their own client ID. But I mean, obviously, Alberta Health Services is huge. There's like 120,000 employees. So there are still pockets that don't have interpretation. It's easy for them to get set up. They can look on our internal website and reach out to me, and I can get them set up in 10 minutes. External to AHS, which would include, for example, doctors in private practice. That is because that is not considered a service that is part of Alberta Health Services as such. We don't cover those costs. However, because we recognize that it is an important service, we share our rates, so we extend the service to outside partners like PCNs, for example. Our rates are like under $1 a minute. If you wanted to sign up directly with Language Line, it would be $4 a minute American. So it's quite a big savings. So we have a lot of PCNs signed up with us. They sign up, and then every month when we get the bill, we just take out however many minutes they used. And then we send a bill through accounts receivable plus a sometimes 10, sometimes 15% overhead to cover administration costs. And there are a lot of PCNs signed up across Alberta. I understand from Stasha that there's one PCN signed up in Lethbridge, and if anyone's interested, my contact information is at the end. Next. And we can just skip that one. What about when phone interpretation isn't sufficient? So we know from research that phone interpretation works in about 80% of cases, but obviously there's those times when you really do need the interpreter to see something, or for example, it's a complex family conference with a lot of people. What are your other options? So we already talked extensively with some great in-person interpreters. I won't talk about that, but we are going to talk about video. So if you can click to the next one, please. Video interpretation is a new option that we have at Alberta Health Services, and we've been slowly rolling it out for the past couple of years. It's kind of basically like, think about FaceTime but encrypted. It's through the same vendor, and I'm actually going to show you how it works. It is available for 35 languages, which is obviously not as many as 240, but still covers about 80% of our need, and American Sign Language, which, you know, something we can do through video and not through phone. It comes, and now I am going to turn on my camera so you can see what I'm talking about, and I'll be famous on YouTube. Hang on. Okay, do you see me?
Yes.
Hi, Ellen. Yeah.
Okay. Hello, everybody. This is what I look
Ellen.
like. I'm famous. I'm going to be on YouTube. All right. So it comes in a couple of different ways. It's basically like an app that you install on an iPad, an iPhone, or an Android tablet or phone. It can come on a pole, and this is going to be, sorry, this is a little bit tricky to show you to fit it into the camera, but we're getting a lot of these in hospitals. It's called an interpreter on wheels. So I don't know if you can see that. See, it's on wheels. It's basically like an iPad. Can you see it?
I'm going to, yeah, people are not seeing you, Ellen.
Oh.
Okay,
Yeah,
I'm just trying to figure
They
out.
were just seeing the box where, you know, it says that she was talking. That's the only thing that was showing. It wasn't on the main screen.
Is it now?
She has to talk.
Okay,
I'm
be
talking
quiet
now. Can you see me?
Yeah, there we go.
And you can see me now? Or you can see an interpreter on wheels?
Yes, I can see it, Ellen.
Okay, so you see it, it's just kind of like an IV pole with basically like an iPad thing attached to it. What you need to use the service is basically just Wi-Fi, and then you have an app. I'm actually going to show you on a separate iPad because there's too much glare on that one and I can't get it close enough to the screen. So you install the app, and you make sure you're connected to Wi-Fi, which can be a challenge in some locations of AHS, getting better with Connect Care, but not perfect in every location. And then, you guys see this now? Basically, it has these 35 languages plus American Sign Language available. And you just click on the button to get an interpreter. So I'm going to just let that load. You can see it's like FaceTime, although it's a bit confusing because now you're seeing the reflection of the back of my desk. So this service is something that we don't fund through our department. However, it can be a good option for in-person interpretation where that's not available. Oh, here we go.
Hello, thank you for calling Language Line Solutions. This is Anna, ID 264991. The call may be monitored for training and quality assurance purposes. May I please have the unit number or name?
Yes, hi Anna. I know this is a little weird. My name is Ellen and I am with the interpretation department, and you are just currently on Skype doing a demo to about 50 people. So I know for a fact we have a Spanish person on the call, so maybe you can just introduce yourself like you would pretend like you're introducing yourself to a patient.
Oh, yes. Buenos días. Yo seré su intérprete hoy. Todo será interpretado y mantenido.
Thank you. And would you mind bringing up your little whiteboard, your notepad, and putting something like, oh, are you there? Oh, it's not really great when they're having a connection issue, but sorry, maybe my Wi-Fi is being difficult. I will just talk while my Wi-Fi is coming back up. It's a good example of why Wi-Fi sometimes Wi-Fi is very critical to this. So one feature, the feature she's going to show you, yes, I can hear you. I don't know why she's, hang on. I'm going to just do this again, skip. Okay. Oh, sorry, I'm really taking up too much time. There's not going to be enough time. I will just tell you, I just hung up on her actually, sorry. Basically, she can bring up like a little notepad, and she can have her translate instructions. Like, for example, take 2 tramadol with food. In case the interpreter is saying something and you want them to remember what that important information is for when they get home, you can ask them to take a picture of it or write it down, and it's like right there on the screen. Yes, it is considered very useful in acute care, and it is considered very useful in emergency departments as well, because it's right there, right? So you get a patient coming in, they're in great distress, they find that kind of calms patients down to have this tool right there. So it's kind of our goal to make sure that we have one of these in every emergency department across Alberta. So I don't know if you have any questions, but if you have any questions, let me know, but I have to stop talking because I know we have one more speaker and we have 5 minutes left.
Thank you very much, Ellen. We do have one more speaker, and that's Elise Tiffany. And she is my colleague here at Lethbridge Family Services, and she is the coordinator for the interpretation and translation program. We've had lots of information covered, but she's got a few more things to share with us. She's been here at LFS for 4 years.
Hello, good afternoon. So most of the information that I had planned on speaking to has already pretty much been covered, so I'm just going to be brief on what I do have. One thing I wanted to clear up was the difference between an interpreter and a translator. The interpreter is a person who is specially trained to convert oral messages from one language to another. A translator is a person who is specially trained to convert written text from one language to another. Now, while the delivery method may differ between the two professionals, both reflect the cultural terms, expressions, and idioms that provide meaning to the content. 2 of our different systems that we use for interpreting one is simultaneous interpreting, and this you will see often when presidentials or heads of state speak or at the UN conference. Hello, can everybody hear me?
Yes.
Okay, sorry. For example, you might see someone standing behind President Putin, or he may be wearing an earpiece, and then they're talking at the exact same time. The ones that we use most often is consecutive interpreting, is where person A speaks the message, the interpreter translates it, and then relays it to person B. Trained interpreters can reduce the liability and help ensure that appropriate utilization and increase client adherence and satisfaction with services. Trained interpreters are not always certified interpreters. To be a certified interpreter or translator in Alberta is a very long, expensive, arduous process. We have one interpreter who's been trying to become certified for over 4 years. He's a very learned man, but he is just not getting to that level yet. Our interpreters are trained fully, and we do constant training throughout the year also. Again, who can and cannot serve as an interpreter? Family is always sometimes a last resort, but when you can, avoid using family because it is a conflict of interest. If you're telling the father you only have 2 weeks to live, the daughter is not going to want to say that. So they may soften the words or give extra hope that is not there. Also, anyone under the age of 18 cannot be held legally liable for what has been interpreted. Also, again, untrained volunteers, patients, other visitors, because those can conflict with the confidentiality. They're not bound by the same confidentiality oath that trained interpreters are. We talked about the interpreter pre-session. I have tried to institute this with our interpreters at least the first time that they're meeting a new client or a new doctor. That way the definitions are set. The client knows that the interpreter is not there to be a friend. They're there with a specific role to be completely impartial. Working effectively with interpreters, allow enough time for the pre-session with the facilitator and the client so that the interpreter can explain in both languages, this is what I can do, this is what I cannot do. It's also good to introduce yourself to the interpreter in front of the client so that the interpreter can also translate what your credentials are, what you've done, where you've been, and what the client is being seen for at that moment. It's also helpful to speak directly to the client. Maintain eye contact with the client when you can, even when the interpreter is speaking. That way the interpreter is just a disembodied voice and you're dealing directly with the client. It's also good to speak slowly rather than loudly, and I think we're all pretty guilty of this. It's just easier to think if I speak slow and loud, but the interpreter is trained to mimic your body tone and your body language and your tone and inflection. If you speak loud, chances are the interpreter will also start speaking loud. Make sure you speak at an even pace and relatively short segments. Sometimes so much information can get jumbled in the interpreter's brain, and they may stop you mid-sentence and say, I need to relay this. Don't be offended. It doesn't mean they're not doing their job. It just means there's a lot of information and they want to make sure they get that correctly. The biggest thing when it comes to medical appointments is remember when using an interpreter, everything that is said will be said twice. So you have to make sure that you allow enough time. Even book double appointments if you know ahead of time that they're going to be needing interpreters, because it's the time that takes from the doctor to speak to the interpreter to the client, and then the client back to the interpreter, and the interpreter back to the doctor. Again, saying that everything in that session will be interpreted. Everything that the doctor says, everything the client says, everything that the client's little brother says, it all needs to be interpreted for accuracy. There is a part about not holding the interpreter responsible for what the patient says or doesn't say. If you're asking the patient, do you understand, as mentioned before, the patient will nod yes. It's not the interpreter's job to say, he said yes, but I don't think he means yes. So it's okay to keep going over that subject again with the interpreter, asking the client to repeat back what he understood. Repeat back whatever information you said to them, just to make sure that everybody is on the same page. If at any time that that the interpreter feels that there may be cultural misunderstandings, or that maybe what you're saying is not as impactful as how you're saying it or how you're approaching it because of these cultural differences, allow the interpreter to bring that up. And it doesn't mean that they're disrespecting your stance. It just means that there's something that may be lost in translation just because of a cultural difference. And again, be patient. Providing healthcare across a language barrier does take time. But as Dr. Bly said, the more time you spend up front, the more you can ensure that the client and the professional are both getting the maximum out of the situation. There was a question about how much interpreters we use for the primary care network. All of our funding comes from IRCC. We do not get a special funding for interpreters. So this is money that we take from the IRCC to fund our interpreters. So we have to insist that wherever language line is available, it should be used. But we do make concessions for certain certain situations. The first 6 weeks that refugees come to this country, their 6 weeks are funded by a different pot. So we always can provide interpreters for that. After that, we rely on the language line when it's available, unless it's something sensitive or a client may have a cognitive barrier in which a human interpreter would be best. I did have a question, and I don't know if anyone could answer this. If a visiting specialist is using an office in a primary care facility, can the primary care facility offer their language line, or is it just for certain doctors to use?
I'm going to hand that over to Ellen or Louise.
Sorry. So describe the scenario again.
For example, we have a visiting gynecologist from Calgary who is just using an office at Legacy Medical Center. Can we insist that they use the language line that is offered by Chinook Primary Care Network? Or are they not expected to use that language line because they're not directly employed with that clinic?
So there's no policy that forces them to do that, but you as your own clinic can say, yes, I expect you to use language line.
Okay.
And this is Louise. I would just add to that, Ellen, that will come as part of your bill, right?
Yeah, if they're using your own PCN client ID number, then it would come at your cost, since we do charge back to the PCNs for their usage.
Okay.
And Ellen, just Elise, I should say. It's so Chinook PCN has an account, and so it's provided sort of, as Dr. Bly explained it, one of the perks of being associated with the PCN. Isn't that correct, Dr. Bly?
That is correct, yep. Can you hear me?
Yep.
Okay.
Yep.
So the PCN does pay for language line services out of their own budget.
And a comment from Palliser Medical, you may want to check with the PCN staff specifically about this, because I'm not sure that specialists are actually technically under the PCN funding umbrella. And yes, it is a dicey area. They would be separate. But I would suggest, if I were the clinician in that case, I would err on the side of safety. I don't know if you want to speak to that, Dr. Bly.
You could make an argument that the patient is a patient of the clinic and that care is being provided for that patient in the clinic. So you could make an argument that yes, anybody helping with that patient's care could use the language line in that clinic, but it would be up to the PCN to actually say for sure whether that's the case or not.
Okay, thank you very much for clarifying that. One more thing I wanted to mention, all the features from Language Line. I have asked and put in our future budget that we can also get services like that, which may be easier than requiring a human interpreter to drive to the hospital on a moment's notice. You'd be able to use their cell phones or a laptop. It hasn't been instituted yet, but I'm still hoping.
Okay, we're well over time. And
let me just, it's Louise, let me just add one comment to that one. We have an exclusive contract, AHS has an exclusive contract for telephone interpretation with a vendor. And we're going to RFP in the next month or two, but that will also be an exclusive contract for telephone interpretation. So if you as an agency want to discuss that provision of service and get a broader perspective, please feel free to give myself or Ellen a call. We'd be happy to chat with you and make sure your investment is well serving you, okay, as long as I understood that correctly. Okay,
great.
Thanks.
Thank you for the offer.
Okay, just a quick thank you to all our guests, and it's an action-packed hour, and I appreciate everybody here and listening as well. So I will let you have final comments, and if there's any quick questions, Dasha.
All right. Well, thank you, everybody. if there's no further questions, I'm just conscious of the time we're cutting into people's noon break. Just a couple of things. I did send you the tip sheet that Elise, sorry, two E words, had shared from Lethbridge Family Services. You would have got that by email. I will also upload this session onto YouTube, as I mentioned, and send you the link. And hopefully we'll get that to you by end of day tomorrow. We are planning probably in December another session. We haven't met to discuss the details, so keep your eyes out for another email from us on our next webinar as part of the Lethbridge Newcomer Health Educational Support Strategy. Thanks, everybody.
Thank you, Stasha.
Thanks, Tasha.
Thanks, everybody.
Okay.